I would definitely recommend Dr. Kassabian to my friends and family. I think he does an amazing job with everything. I think this has been the best decision I ever made, and I just can't thank Dr. Kassabian enough.
I couldn't be happier with my results. From start to finish, the process was so easy. Dr. Kassabian and his staff were amazing, so patient, so compassionate.
My nose was a big concern for me for years in my life, and I have finally been able to overcome my concerns and have so much more confidence. I've been getting compliments left and right about how natural and good my nose looks.
So this has been such a great experience for me. I've recommended it to 3 or 4 of my girlfriends already, and I just want to tell Dr. Kassabian thank you so much. It's been great, and I feel so much better. Thank you.
I just finished with Dr. Kassabian, and he did my lip filler very fast and no pain at all, so I'm excited.
He boosted up my confidence, and now our people compliment me all the time. I'm very thankful to Dr. Kassabian for this big gift.
Everything went better, much better than my expectations were. The healing was super fast, very little discomfort. I was just amazed at everything. I mean, what he did was a lot of wonderful work, and it's absolutely great. And this was the best idea to come down here and get this done, because the staff is wonderful, everyone's great, and I would do it again in a heartbeat.
I should have done this ages ago. I feel so much better about myself, I look better in clothes, and I'm just an all-around more confident person. Dr. Kassabian and his whole staff have been so wonderful through this process. They answered all my questions. Dr. Kassabian did a great job, and I'm so happy with the results. This is one of the best things I've ever done in my life.
Hi everyone, it's Lilly Ghalichi, and you are on GhalichiGlam.com. I am here with Beverly Hills' most prominent plastic surgeon, Dr. Kassabian from LiftMD. Thank you so much for being here.
Thank you.
So not only is Dr. Kassabian the biggest celebrity plastic surgeon in Beverly Hills, he also happens to be my plastic surgeon and a very close friend of mine. So I am so honored to be doing this class with him today. This is our most requested class. Everyone wants to know what plastic surgery I've had, what do I recommend, what do I not recommend, lasers, Botox, fillers. So today we are going to talk about all of these things. Now, plastic surgery is a big decision, but it's also a changeable decision. And when I was much younger, I wanted very large breasts. So I have 550 cc's of silicone, for those of you that have asked. And doctor, what are we going to be doing to my breasts? Because I think they're a little too big for me at my age.
You want them to go a little bit smaller, so what we need to do is address the pocket for already formed the capsule. So that capsule needs to be either thinned out, or if it's not thick, then the pocket made smaller to fit the smaller implant. So that it looks better and also less side effects like capsule contraction.
This is why it's so important to go to a really good, credible plastic surgeon. This is your body. You just have one body, you just have one life. And just because you can get a good deal at some back alley place, you might have serious repercussions from that surgery that cause you to get a second surgery, a third surgery, and you end up paying more than you would have paid had you gone to somebody really experienced and credible like Dr. Kassabian. I'm very excited to reduce my implants, to clear this scar tissue and have more natural breasts. So we'll share that journey with you when September comes. So what else have I done? I get a lot of questions if I've had ribs removed, liposuction. Doctor can attest, I have not.
No.
But fat transfer, if you do have a little bit of extra fat, is becoming one of the most popular procedures. You see all of these celebrities and models that have this itty bitty tiny waist and this big old butt, and I can tell you that is not natural. So Dr. Kassabian happens to be one of the leading doctors for lipo and fat transfer. So how exactly does that work?
Do liposuction to give shape, liposuction in the waist area, the abdomen, the thighs, and then wherever identify wherever there's deficiencies, like the size of the hips.
Like right here.
Where you need fat added, add the fat there, add it on the butt, especially. Do I inject it deep into the muscle so it lasts? The muscle is a good environment for the cells to last for the transplant. And also on the face, also we use some of that fat in the face. It's very good because the fat cells, the blood vessels in the fat cells have stem cell properties. So
wow.
it rejuvenates the skin also, besides giving you volume. That's why people who have fat injections on the face, they have a glow. So it's not only the volume, it's also the skin is healthy.
So could somebody relatively thin like me do fat transfer, or do I like to the face?
Yeah, I just had a client, she was your size, and she really wanted fat injection.
Okay.
And I said, well, you're gonna have to gain some weight. So she sat home and ate everything she wanted and gained that 5 to 10 pounds, and we were able to get all that fat and put it in her butt.
Oh, put it in her butt.
But yeah, and now she looks fantastic and she's obsessed with this stuff.
Amazing. And ladies, don't be embarrassed about having plastic surgery. You don't need to tell anyone. It's nobody's business. Plastic surgery is a very personal decision. But B, it doesn't make you insecure. It doesn't make you any less of a person. And today's day and age, everyone is doing it. I literally don't have a friend that hasn't had some sort of enhancement, and that's exactly what it is. You're still you, it's a better you.
Right. Well, the advantage is these days we have very safe solutions and solutions for a lot of people's concerns. So why not put your best face forward, so to speak, you know?
Absolutely. And I know for me, I was very, very flat-chested. I had no boobs. I literally had nipples on a wall. So such a simple procedure gave me more confidence, which carried over into all areas of my life. So like he said, it will just be putting your best face first, and it's nothing to be ashamed of.
Yeah.
So that's my only surgery on my body, as I've done my breasts. Now on my face, I have tried Botox and I have tried what they call fillers. Now fillers it's just hydrochloric acid, which is an acid naturally occurring in your body. There's many different kinds of fillers, Restylane, Juvederm. So the difference in all of these are mainly how long they'll last, right?
Right.
The thicker they are, the longer they'll last.
Right.
Now I've done both fillers and Botox, and Dr. Kassabian has done all of my fillers and Botox. I Botox right here in between my eyebrows, and then I'm 32 now, and I've noticed that I've started to get this. I've started to get some hollowness. So I've recently tried some fillers there, and I cannot be happier. The doctor does a very, very minimal amount of Juvederm Ultra, right?
Yes.
And I feel like all it does is take me back 5 to 8 years.
One thing I want our viewers to get out of this session is one lesson they learn is the difference between Botox and filler. Botox is a muscle relaxant. It doesn't give you volume, it just relaxes the muscle to get rid of wrinkles. Fillers give you volume, and with the new like injecting your lips, fuller lips, like the nasolabial folds here, these smile lines, filler. Under eye, that's filler. Cheeks, that's filler. Now with the thicker and thicker fillers like Perlane and especially Voluma, you can get a lifting effect because it's thick, it can lift up.
And that's where you get the cheekbones.
Right. The way I inject the Voluma is like lift it up and then inject it like that so that it holds the cheeks up, the structures up.
So I would say the most common trend today for fillers is the lips.
Yes.
You see all these girls on Instagram with these giant, beautiful lips, the Kylie Jenner lip. That's all filler, and it's temporary.
Botox, it wears off. Something you don't like, it wears off in 2 months or a month and a half. Fillers, if you don't like it, especially these fillers, this category that we're using, the hyaluronic acid gels, there's a product, an enzyme, you can inject and melt it right away.
So you can get rid of it the next day.
If you don't like your lips that big, or there's a lump or something, you can melt it, or first you can massage it, even it up, and then if you don't like it, then you can melt it and it's gone. And
no
you got
commitment.
Side effects. Yeah.
Now we are gonna have demos for you. We're gonna do live demos of everything the doctor's been talking about, Botox, fillers, and different areas of the face. So let's bring our first model in.
Yes.
So tell us your name and your concerns.
My name is Dylan Fitzpatrick. I just kind of heard recently that you can use Botox for more than just lines, that you can actually like make your resting face look better than it actually looks. And then also my lips, I find them to be a little uneven, so I was hoping that he could put lip injections in and make them more even.
Yeah. So Dylan's concerns were the fine lines here around the eyes, and she wanted a little bit of a lift. We call that the chemical brow lift because we're using Botox to lift up the brow. And then injecting these fine lines under the eye, we're going to inject Botox, minimal drops in the under eye. Also, her concern was the fullness here, so we're going to do some Botox in here. This is the master muscle. Bite your teeth, clench. You see, this is what we're going to inject, this muscle here. So to soften, when you soften this, and the cheeks are going to be accentuated. And at the same time, she was bothered by this area, so we're going to inject some Juvederm in this area to like give this kind of look. And then we're going to do a little bit of the lips. Okay?
Let's do it.
Let's do it. So a lot of the fillers, I'm using a cannula these days, and those are, it's not a needle. It's a, what I'm going to be using. It's like a tube. It's not sharp. That minimizes the bruising and the swelling.
So immediately with the filler, she is gonna have a more prominent, larger jawline. And like you see, filler is what they call a lunchtime procedure. You don't have to take time out of your schedule. You don't have to plan a surgery. You literally go into the office, get it done, and leave.
So
wow.
You see the definition, and
it looks great.
I look beautiful.
so next we're gonna
yeah, instant.
So you see, I'm sliding in. I'm like, the tip of it is here.
Wow.
Yeah.
So that way there'll be no bruising on the lips.
Right.
So what are we doing here?
We're softening the chin a little bit.
How are we doing that? Is this
just a touch of Botox, and what that does is that gets rid of that orange peeled, wrinkled look
at the bottom of the chin?
Yeah, in the chin area. Okay.
Look at how beautiful that looks now. She has that L shape.
Minimal bruising, minimal swelling.
And definitely go to a good doctor for that because I've seen it done bad.
Horrible.
Yeah.
Horrible. So how long will all this last? Last question.
The Juvederm lasts 6 months to a year. The Botox 2 to 3 months.
Well, enjoy your beautiful new face for the next year. Thank you. So this is Bianca. So tell us your concerns.
Okay, so my eyes look hollowed and I need some filler, and then I have
Nasolabial, the smile lines there. Yeah.
So I just want them smoothed out a little bit softer.
What I'm gonna do is I'm gonna put Juvederm here.
Okay.
Dilute Juvederm in this area to soften up this tear trough lip cheek junction. And then gonna go in from here with the cannula, filling this up, and then fill in the nasolabial fold through here again with the cannula.
Sounds great.
So I'm all the way here with the cannula.
Okay. So you're filling her under eye all the way from there. It instantly filled that little bit of hollowness that you have.
That's just half a syringe I did.
I prefer conservative, and Dr. Kassabian is always very, very conservative, so.
You can always go get more if you want more, but the last thing you want is a physician that's just gonna fill your face with too much.
So you see, not only filled up this, and it also lifted her cheek.
That is incredible. Yeah. So, Buzz Lead asks, how long do fillers last in the lines around the mouth?
The filler itself lasts 6 months to a year, but I've had patients where the filler lasts much, much longer, years, because of the collagen buildup in the area. The more you layer it, the more it's gonna last.
So Betzley also asks, for between the eyebrows, is Botox or filler used?
Good question. For the glabella, in general, we use Botox. That's to relax the muscle. But some people have such deep lines that you need to add some filler.
And Botox.
And Botox, yeah.
Now the next question is very appropriate. Alexander says, good evening. The areas under my eyes really started to sink in after turning 30. Is there anything I could do for that so I don't look like I have shallow caves under my eyes? That would be safe. Thank you. Well, that's exactly what the doctor is doing right now to our gorgeous model. She has the same area of concern, a little bit of hollowness under her eyes, and as you can see, the hollowness is disappearing before your eyes.
So after injecting, I massage it to mold it into shape. Well, as we say in plastic surgery, this unveils the beauty that's there.
Beautiful! You look amazing. You still look like you. It's just a little bit more refreshed, a little bit more youthful.
Thank you.
Thank you so, so much for being here and for being our model.
So what we're gonna do, we're gonna do the Beverly Hills vitamin cocktail.
What is that?
This is a mix of vitamins that gives you energy, boosts your immune system, and at the same time relaxes you.
Have you tried it before?
Yes, it's like a tune-up for me. I walk out feeling like elevated.
So this will slowly drip in and just give her an instant boost.
Right. So while she's doing this, what we're gonna do is microneedling. The microneedle is like a laser, but it doesn't burn like a laser. The microneedle goes in, rejuvenates the skin. She'll see the result almost immediately.
So while you start, let's take a caller. Hi caller, what is your name? Where are you calling from and what is your question?
I am Savannah Ellison and I'm calling from Oahu, Hawaii. I want to know the difference in different fillers in breast implants.
The difference between saline, silicone, and say the gummy bear.
Breast implants, it has an outer shell, that's the envelope it comes in, or the outside pocket. That's all made out of silicone. Silicone has a bad rap because of the silicones before were liquid silicone. They were like olive oil. So when they were ruptured, it would leak out like liquid. The silicones now, they're more cohesive. When you cut it, it doesn't leak. So this is the regular silicone implant, smooth, round. And this is like the actual gummy bear implants. First time implants, I would recommend this.
So to answer your question, as a first time implant patient, doctor would recommend a smooth implant with the new cohesive silicone.
Yeah, yes.
Thank you so much for calling.
The vitamin is done, wow.
Oh, amazing.
You could feel it right away.
So, Katie, do you mind describing what you're doing?
So we're microneedling with a hyaluronic acid serum. She doesn't really have too many imperfections on her face, just overall tone and texture. It helps with tiny fine lines, pore reduction. It helps with acne scarring, little brown spots from the summer, from the sun. It's just people tend to be very, very happy with this. Sometimes it takes 3 to 6 treatments. Some people are perfectly happy with 1.
So what does it feel like as a patient?
It just feels like vibration really to my face.
Yeah.
It doesn't feel bad at all. It kind of feels more like a massage.
Yeah.
It's hundreds of needles. They're going in at a specified depth. It's rotating really fast. And at the same time, besides making the needle holes, it's penetrating the serum that's there. A lot of the skincare products we use, it doesn't penetrate the skin. This helps the product go inside the skin.
And what's the downtime for this procedure?
This is the redness she's gonna have.
Yeah,
That's
she'll
it.
just be a little
That's
red.
it.
Just for tonight.
That's it. Just for tonight. By tomorrow she'll be fine.
So a very common question we're getting from more than one person is the cost generally for lip fillers. So what would a patient expect to pay to get, let's say, a syringe to get their lips done?
I'd like to use the best product possible so they get the best experience from it and it lasts a long time. So I use the Juvenium Ultra Plus and that's around $7.50 a syringe.
That's not bad considering the results are 9 months to a year.
So half the face is done and then good as the other face, that's gonna take.
Beautiful. So now you guys have learned about Botox, fillers, breast implants, fat transfer, facials, microneedling, everything you can think of and more. And for those of you that want to try any of these procedures in the Los Angeles or California area, I would not recommend anyone but Dr. Kassabian at LiftMD in Beverly Hills. All of his information is on his Instagram page at LiftMD, Dr. Garo Kassabian. Follow him, and if you're gonna do plastic surgery, do it safely with somebody like Dr. Kassabian. Thank you so much for being here.